Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by my very stimulating co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin.
Stimulating's good.
How you doing?
This is good.
It is. We're talking about numbness. So,
yes.
Yeah.
Okay,
so
good.
stimulating is very, very good.
Got to stimulate the area.
Yes.
Okay.
So this is our first episode that I'm titling Plastic Surgery Masterclass because we are diving deep on a topic. However,
I should have prepared.
We're talking about a very frequently asked question about numbness after surgery. And if you're not wanting to hear the nitty gritty from used to be anatomy teacher talk about the anatomy of nerves, look in the description box below. Skip ahead. Just skip ahead to what you want to
write
hear.
A comment like, why is this lady talking about nerves for 10 minutes?
Yeah, don't like lose us in the weeds. Like you're like, I don't care about this. Tell me why I'm numb. There's a timestamp for that. So just please feel free to skip ahead. You're not going to hurt my feelings. Sleep through my class. It's fine. But you can find us on all social media here at Beauty and the Surgeon podcast and at Jason Martin MD. While you're looking at the description box, maybe just hit that subscribe button.
Yes,
we would really appreciate it.
And then the phone number, right? What's the phone number?
Phone number is 303-630-9038. You can leave us a voicemail. You can also send us a text. If you go back to March and April of 2024, you can hear some really awesome episodes where we answer some questions from listeners, voicemails, and some really fun texts. So leave us one. Okay, so Dr. Martin, this was actually recommended by Nils. He said that it's a common thing that people seem very confused about why they could be numb after surgery.
Yes.
And being the extra that I am, I, then
created a master class.
Right. And then had to cut out about 90% of it. Right. So this is 10%.
I get to see you feverishly on a Sunday, like, oh, we're going to have so much information.
Oh my gosh, it was deep. I mean, I'm not kidding when I say that I went through and weed whacked about 90% of this episode out. I did.
That's good.
And so hopefully we are going to talk some about the anatomy of nerves, what nerves are. We're going to do some fun quizzes. I wish I was in the magic school bus inside the nervous system, but we're going to try not to get too deep. But again, if it's getting too deep and you're like, I cannot listen to this, just skip ahead.
So you're not old enough to remember Mr. Goodbody. Do you remember him?
I am. You and I are basically the same age, man. Yes.
The guy with the
so freaking creepy.
So creepy.
The skin
suit. But he never had the nervous system on there.
Oh.
It was all organs.
Muscles, though.
He had muscles.
He had muscles.
Yeah. Oh my gosh, that was, even as a kid, I was creeped out by that. Like, wow, this is creepy. Fascinating, but creepy.
I saw someone in a Halloween costume, perfect. Like, I was like,
and it was very tight. That was a tight.
It was spandex.
It was super spandex.
Yes.
It was tight. Yeah.
I mean, so props to someone who can rock that, but.
Right.
Yeah, he could rock it.
I don't know where he got it, but I was amazed.
Very interesting hair.
Yeah. Okay. All right.
Wait, actually, just show a picture of him right here, Nils.
Oh, for those of you who are younger than, let's say, 40, who never were exposed to that as a child. And if you don't know the Magic School Bus, well, she was a curly-haired redhead too, so that's maybe why I like her so much. All right. So numbness after surgery is common, and sometimes it's on purpose. So the times it's on purpose are when you have had a nerve block, right? You're numb on purpose. We made you numb. You could also still have some lingering effects of local anesthesia that are on purpose. Dr. Martin, talk about some of the different types of local anesthesia and their lengths of life, essentially.
Yeah, so we have basic types of local anesthesia, the types that you get at the dentist, like lidocaine. Those last an hour or two. And you think about when you go to the dentist, how like the numbness lasts. We have ones that last a little longer. That's what we use primarily in our surgeries. One of them is called bupivacaine. These last 6, 7, 8, 9 hours in terms of like numbness. And then we have ones now that have come out in the past 5 years that last even longer. And that could be a couple days with the liposomal products that exist. So, local anesthesia, there's different types and it's not all the same. And that doesn't even account for long-acting pain pumps and stuff that we use.
Yeah. Or for blocks, that are super long lasting. If you're waking up from surgery and your whole arm is numb, well, and you had surgery on your wrist, that's probably why.
Yes.
It is numb on purpose. So that's the kind of
waking up from any kind of surgery and having numbness transiently is pretty normal because they're going to use local anesthesia. And the reason why we use local anenesthesia with surgery, I know this is your master class.
Oh, no, you go.
All right.
Yeah.
So it's both of our master classes.
Yeah. Okay, this is not like my diatribe.
I know. I was going to go sit with Nils so I can listen to you.
No, never again.
Okay. The reason why we use local anesthesia during surgery is that you feel pain even when you're asleep. So
because of your nerves.
Right. And the idea that you reduce pain sensation will reduce the amount of anesthesia that you need to keep you asleep.
And stress on your body.
Exactly.
Mm-hmm.
So it's very important that you get local anesthesia during surgery, even though you're asleep.
Yeah. So numb is normal right after surgery.
Yeah, you should expect that.
Yeah. positioning during surgery. So just like when you're, in a position for a long period of time, you can have a limb kind of go to sleep, right? Or be numb, wake up and have pins and needles. Like we do a lot of things during surgery to position you and move you. But I mean, ultimately, if you're having surgery that's 3+ hours long, you might have a few little areas that feel a little pins and needly kind of numb.
Right.
And that's normal. You can have nerve disruption or damage around the incision. That can cause numbness. Swelling or tight dressings. That's something that people maybe not think about. Like, oh man, it's numb. And they're like, you look at their hand, you're like, well, maybe we need to loosen that up a little. So these are the 4 things that are just kind of normal causes of numbness after surgery. And we're going to talk about these in a little more detail, specifically about the nerve disruption or damage around the incision, because that's what we do around surgery in the future slides. So let's talk about the nervous system. There is so much information on this slide, and it's all very tiny. So on the very basic level, the nervous system is a network of neurons that send and receive messages, modulate neural impulses between different systems and parts of the body. It's broken down into 2 main regions that then have smaller sub-regions that I have tried not to get into. We've got the central nervous system, the CNS. I think a lot of people know what that is.
The spinal cord.
And your brain.
And your brain.
It's the computer of your body.
It's the hard drive.
Yep, essentially. Then you got your peripheral nervous system, which is the PNS, which is your spinal and cranial nerves. So, Dr. Martin, you and I had to memorize all the nerves, the 31 nerves that come out of the spinal cord. I mean, like, oh my goodness, we're not going there.
So med school, like the first class you take is anatomy.
Yeah.
And it's so arduous. And I have to tell you, when we got to the nervous system, I was ready just to leave school. I mean, it was like so much stuff to remember. And that's when it got really hard, especially the areas of the brain, some of these peripheral nerves. And in anatomy, they would dissect out these small filament nerves. They're super small. You could barely see them with the human eye. And they're like, what is this? And it's like, okay. So it's such a complex system. By the way, I just saw a picture on what was formerly Twitter. It was actually from a museum, and they had taken the nervous system out of a human, and that's all that was there. You could see
in the human body exhibit.
Yeah, and you could see the arms and legs. It was kind of filleted out with only nerves.
Yeah.
And it was magnificent.
Have you've not ever been to the human body exhibit?
I did, but
because that's there. That's where that is. They have just the nerves.
The one I went to, I don't remember the nerve thing, but I do remember the muscle one. So I don't know if I went to the full exhibit or maybe I saw one of the traveling exhibits.
No, they have that there with just the nerves. It's crazy. So here's my first trivia question to whoever wants to take it.
Are we asking the listeners?
Yeah. What is the length of all the nerves in the human body?
Nils.
If you put them end to end, every one of them. Do I even have a guess?
Do you think it's like 100 feet? Do you think it's like
I think thousands.
Miles? Do you think it's like miles?
Yeah, maybe like 10 miles.
60,000.
60. Oh, that's right. So it's almost to the moon or something.
It go around the Earth twice.
No, I was going to say the circumference of the Earth. That's
twice.
There we go.
Yeah,
okay, so,
2 times around the Earth almost.
I was trying to remember if that was like.
Yeah, I didn't know if it was once or twice.
Yeah.
I remember reading that somewhere.
60,000 miles. So your nervous system it's the brain. I mean, it is your brain, but it's telling literally every other thing in your body what to do, essentially.
That blows your mind.
Yeah. It's longer. I mean, more than anything else. I mean, like you think your intestines are so long, like 15 miles. Like, that's nothing, or like 15 feet, like it's 60,000 miles of nerves, because they are literally key, as we'll talk about as we get more into what they do, to every function in the body. For our purposes, for numbness around surgery, we're talking primarily about the somatic nervous system, which is a subset of the peripheral nervous system. There's also the autonomic nervous system, which people, you hear a lot about your autonomic nervous system, like fight or flight, those kinds of things.
Yeah, and then autonomic would also be, in a lot of cases, the gut motility,
organs,
things you're not thinking about that work just on its own. So they're always working all the time. That's the autonomic system.
Yeah, and we'll talk about that in a little bit more detail. 2 main types of cells make up our nervous system. Neurons are the main structure and function of the cell, like the functional part of the nervous system. There's 2 types. There are efferent and with an E, efferent and afferent. So away from and to.
Back to.
Yep.
Yeah.
So from the central nervous system to the peripheral nervous tissues would be our efferent, and then afferent are going to be from the peripheral nervous tissues back to the
think an old school telegraph. You have to have a wire that goes out and a wire that comes back.
Yep. So there's
actually, I don't know if they use the same wire, but you get the idea.
Well, they're going in different directions.
Yeah, I got you.
Yeah. Every neuron has a single axon, but that's what's conducting essentially impulses away from the neuronal body. but it may have a lot of dendrites, this gets into why the nervous system is so big, because there could be like, think of it like branches, there's tons.
The way I think about nerves, think about a tree that arborizes. You have this trunk and it keeps going smaller and smaller and smaller.
And many
right.
more.
I live in an old neighborhood that has real old oak trees, like 100 years old, which is really rare in Denver, actually. It's weird. In the East Coast and the Midwest, you see these deciduous trees that are like huge oak trees. And if you look way up at the top, they arborize, they just keep going forever and ever. And that's like the nervous system. It gets smaller and smaller.
Yeah. The key thing here is that the axon is what's taking impulses away, like toward these little, peripheral parts of the body. But then all the dendrites essentially are what's sending everything back, which just shows you how, like finite things like little teeny feeling on the surface of your very tiny fingers, like that's all what's going back into your body, but you can process so much information that way. It's fascinating when you really think about what it takes.
It really is.
Glial cells, you guys have heard me talk about my love of the brain and lymphatic system. We're not going to talk a lot about those, but these are non-excitatory cells. So they support neurons. Like they have, that's basically what keeps all of the nerves healthy. It maintains your, every time I say this word, homeostatic balance. Dr. Morris says I say it weird, provides structural support. So it's protecting, it gives nutrition. These are really key to keeping all your nerves healthy. So let's talk a little bit deeper about the somatic nervous system, because in what we do, surgery, somatic are the things that we are impacting essentially.
Yep.
These are things that are part of the skin, skeletal muscle, joints, connective tissues. These are all, and they're sensory nerves, meaning that they have function that is somewhat our ability to act upon it. Like they're not the things in the autonomic nervous system, which are like organs and our breathing.
Like if you're constipated, you can't think to yourself, I need to be less constipated.
Or like move my large intestine, like peristalsis happen. Yeah.
Just concentrate on peristalsis.
Right. Like your body's like, whatever.
Yeah.
So this is what brings sensation. They are voluntary, meaning that they have information going back and forth between the peripheral and the central nervous system. It allows us to feel things, feel sensation.
So like really how we interact with the world is the somatic nervous system.
The position, proprioception. Yeah. That's key. It's things like touch, pressure, vibration, pain, temperature, stretch, things are being stretched out. And also, like Dr. Morris said, it's your position in the world. Like that's literally how you know where you are, and being able to like touch yourself and know where something isn't. Like you can touch your own hand in the dark. How? It's your nerves.
Yeah.
Like it's all of those things. So fascinating. Something else that's really key to understand. So now you know that their nerves are what you're feeling for pain, for touch, for pressure, numbness. Why? Well, there's these areas at the end of the axon. So your nerves are not all one continuous nerve, right? But they also they're not like train cars. They don't completely mesh up with one another. Well, I guess they are kind of like train cars. They're not like bricks. So where they get close together, there's this space, this synaptic space. Synapses are like firings, right?
So we talked about this in the Botox episode. That's what it does. It affects that neuromuscular junction, that junction between the nerve and the muscle itself.
Well, because what's in that space?
Right.
It's little chemical signals, essessentially. Yeah. So what Botox does is it tells those chemical signals to stop it.
Yeah, that we're not going to release anymore.
Yeah, it caps them, essentially. But this is where then they're able to communicate things. And this is also where the central nervous system sends things. So the nerve gets to the end, and then whatever chemical milieu is in that little synaptic space, like, oh, okay, we need to do this. This is where you get feedback loops. And this is where a lot of what we deal with in surgery, pain, numbness, are part of these feedback loops. You can have negative and positive feedback loops. I think the easiest thing to describe these is like a thermostat in your house. You set it to 75 degrees.
Oh, my wife always turns it up. It drives me crazy.
So when
What about you, Dills? What does Sarah do?
Yeah, she gets much warmer than I do.
Yeah, so she's turning the AC up.
Yeah. So, and I like really cold too. But
yeah,
it's still one of those things where I'm like,
not
how are you hot? Like,
Amy and I are kismet with temperature. Like we both like fall into the same category.
Gotcha. Yeah. We're Sarah pretty close, but it's still like there's sometimes like I cannot understand how you would be.
I like a warm space. Yeah. But basically in this little synaptic area is where your nerves can essentially be told to speed up or to slow down. And this includes things like wound healing. The nerves and all this kind of chemical milieu that's happening in the interstitial fluid and the synaptic spaces are telling your body, taking it back to the brain, right, to the mastermind, literally, what do we need here? Like we're bleeding.
Right.
Send all the clotting factors here. Those are your nerves that are doing some of those. It's all part of it is what's giving the signal back to your brain about what's happening in these distal parts of your body. So you can get into, negative and positive feedback loops and things like addiction, dependency on pain medication. Those are nerve driven, which I think surprises people.
Yeah.
Like that's anything that's communicating back to your brain is coming from chemical signaling in your body, but those chemical signaling things are usually being carried back by nerves.
Yep.
It's all the electrical firing. Something that I find really fascinating, you get 60,000 miles of nerves. How do things get there so fast? I mean, like, it's not like you don't know you're doing this right away. How?
And there is a lag. There's I remember it's less than a second, but there is a lag. So if you, cause damage to your fingertip, it takes a tenth of a second or whatever that number is to get all the way back to your brain. It's so crazy when you look at nerves, the anatomy of nerves and how they propagate an action potential. And it's basically just like sodium and potassium. And they just...
That's the negative positive part of it. They have
push
charges.
The positives out and it's like a electric charge that goes up. It's no different than the electrical wires that are in your house or whatever. It's the same...
Cable internet.
Yeah, it's the same thing. So it's like when you see that, you're like, oh, that makes sense. And that's exactly what local anesthesia does. It stops the propagation of that action potential by not allowing the sodium or potassium to go out of the axon itself.
It's like pain medication does the same thing. Opioids don't actually really reduce pain. They just tell your brain that you're not feeling pain.
Yeah, I mean, that's the problem with opioids, though, because it's not stopping the pain stimulus. Nope. It's just numbing your brain.
Exactly. Right. And that's why people will find, and when we encourage them, you need to switch to Tylenol because you'll actually get more pain relief.
Right.
And you don't need the head relief, essentially. So it really, the nervous system is fascinating. So here's my one other, before we get into the stuff that people actually want to hear about, my last fun fact. Largest nerve in the body. What is it?
What's that one that goes down to? You guys, I'm going to start having editing and video questions for you guys. Next episode, quiz.
We established you're the eye candy. Yeah. Don't worry about it. Yeah. We're not getting you for the brain, even though you're smart.
Yeah, I show you oh man, I can't.
It's not some obscure thing. It's something that people know.
Yeah.
It's your sciatic nerve.
Sciatic nerve. Okay.
Yeah, so gotcha. I would have said, so I didn't know the answer, but I would have said vagus or sciatic.
Vagus is what I was thinking of, because when people have problems with that vagus nerve, it can really.
Oh yeah.
So vagus nerve is pretty big, but the sciatic.
Yeah,
would be
the
bigger.
Sciatic is that because it goes all the way down. That's why
no, but
it comes from your lumbar spine.
Comes from your lumbar spine, but you think about it it's just like any other conduit that carries an electrical signal. Yeah. It's going to your legs, and there's a lot of signals going to your legs, right? And it controls a lot of stuff.
Is it because it's so big that a lot of people have problems with being pinched?
It's the way the way it comes out and then curves around and then goes to the lower extremities. It gets trapped into nerves and then bad joints and all this kind of stuff. So sciatic pain is a real thing.
Yeah, that's the thing I hear most from people if they have some kind of nerve thing. It's always sciatica. So
and it's not only is it big, but it's also becomes very superficial in some areas as it comes through the glutes. So and the back of the leg. So those are my fun tips. But I just from this take nothing else, and then we're gonna get to the fun stuff after.
Else that Amy is a complete and utter nerd.
I am, and your nervous system,
and I am too.
It controls way more than you think, and there's a lot that can, not a lot that can go wrong, but when things do, you see why that effect can be pretty major, right? It can affect your entire body because one little thing, I mean, like a paper cut can be the most annoying pain you've ever had, because it's just constantly irritating because those nerves are constantly wow, this is happening.
Right.
Yeah. So let's take a quick break, and when we get back, I promise we're going to answer your questions about why you are numb. All right, we're back. For those of you who made it through my crash course on nerve anatomy, thank you. Yay. And now we're going to talk about what does all of this mean for me and my numbness, right? What does this mean at all about why I'm numb? You told me about how a nerve functions, but why am I numb? And how can I make it go back to feeling normal? And I think that's the number one question we get.
Yeah.
What can I do to get my feeling back? So there's the three different types we talked about. Remember, we talked about positional, incisional, and then the really rare that we didn't talk about before, and this is extremely unlikely, as a result of surgery, which would be a neuromytesis or an avulsion. Now, an avulsion is at the spinal cord. It is, you cannot recover from that. There is no ability at this point. And I did put currently, there's no ability to repair for that. So that's where people, I think, when we talk about you can repair nerves, they're like, well, then why can't you make a person who's paralyzed walk again?
Right.
And why is that, Dr. Martin?
Okay. So nerves do regrow. We know that because we do nerve grafts in plastic surgery. We do flaps and nerves regrow in there. But there's certain types of injuries basically along the spinal cord, those main part of the nerves, that the nerves do not regrow. And that's probably because of the diameter, thickness, and everything that goes along in there. There's so many types of axons going through. It's not just one nerve to one area.
Yeah.
And in that situation, they have not figured out the special sauce to cause nerve regrowth.
To rejuvenate that.
Right. And that's like a big field of study, and it's probably in our lifetime, we're probably going to have some answers there, but they don't have that yet.
Yeah. And the other, like kind of full nerve injury can be repaired, as Dr. Martin mentioned. And you can actually, I remember what episode we talked about this, where you basically, you bridge it. You create a little bridge between the two edges.
We're going to have Nils figure out that episode right here.
Yeah. If you can.
Yeah.
Good luck,
Nils.
might think, I'll think of it, Nils, also.
Let's go through 171
So essentially, like, let's say you have a pretty major nerve that was completely severed. Okay. Like my brother, when he was in 9th grade, was using his infinite wisdom to take the cap off of a pen with a
digital
pocket
nerves.
knife.
So digital nerves run on either side of the finger. They get cut all the
pocket
time.
knife straight through the pen and through his finger.
Yeah.
So they were able to reattach it, right? And he could move it and had feeling.
Yeah.
Some feeling. He had some parts that were numb forever because they were so damaged. But Dr. Martin explained this in another episode. Like, you literally just, you basically, allow it to arc, essentially, and it builds itself back.
If you have
the space.
if nothing's taken away, you can just put the ends together and sew it together.
But if a pocket knife took a huge chunk out of it.
The chunks out of it, then what we use, and this is in that episode, I forget which one, we had these little channels that you're like implants you put in, the nerve kind of grows through it. It's like a hose.
Yeah.
It's the same way I repair an audio cable.
Yep.
Except
Exactly.
It doesn't heal itself.
You
I just
use
take
duct
a
tape.
piece
You
and I
keep put it back forth.
tied together.
Yeah.
Exactly.
You're basically kind of giving it that myelin sheath and then allowing it to work through it.
And not getting too into the weeds and nerves, but myelin sheath and the stuff on the inside is all the meaty stuff that everything goes through. But that myelin sheath is super important. There's diseases that destroy the myelin sheath, and then the nerves aren't functioning normally.
Yep. Like MS, things that attack it.
Yeah. One thing, and then we'll go through this, but the other thing that's really common in surgery, especially like surgeries that involve a lot of retraction, orthopedic surgery or general surgery, is something called neuropraxia. The nerve itself is not avulsed or cut. It's stretched and damaged so much, it's bruised, it's stretched, that the action potential, the electrical current, has a hard time getting through. So people have quote unquote numbness after surgery.
Well, it's like a sports stinger, like getting like a stinger.
Yeah.
You get a hard hit, and it kind of causes that numbness.
Yeah, or that feeling
That's
of like when you hit your elbow and it's like just, it's kind of numb, but you still have a little bit of sensation there. So that is real common after surgery, and that's probably the most common reason for people to have quote unquote numbness related to big surgeries. But what we're talking about is more incisional stuff today.
The same holds true.
Yeah, it does hold true.
You mentioned that we've been doing so many facelifts lately. I mean, we do have a retractor holding that face flap up for a long time. That numbness is from two things. It's from the anesthetic that we put in, but it's also from the positioning, essentially. Yeah. And from the dissection.
Which we'll talk
it's all
about.
three of those. So positional, we kind of talked about. This is being in one position for an extended period of time.
Yeah, this is me waking up in the middle of the night.
Yep.
I always wake up with numb hands. It's probably nothing good. It's probably something with my joints.
Well, it's probably because you've been in one position too long. It's like, I think in anatomy, you always hear the story.
I work hard and I sleep hard. Okay.
Yeah. The person who, was so drunk that they passed out and didn't move for like 12 hours and ended up like permanently damaging the nerves to their arm, like that can happen. So that's why we take a lot of care, during surgery. We actually put like the egg crates under all your joints. Like we make sure that you're moved around. But if you're having a surgery, your arms are, split, stretched out to your sides for 4 or 5 hours, you can expect some weirdness, some numbness, some pins and needles. What's the cure for this? Walking, mobilizing the area, like gentle movements. If it's in your hand, getting that, and if orthopedics too, they really encourage you to like move your distal extremities, wiggle your fingers, wiggle your toes, like get that blood flowing back in the area. Usually goes away within a few days of surgery, maybe even a few hours of surgery. And it might kind of feel like pins and needles, like that pins and needles. We had one patient who had constant feeling of pins and needles in her leg after a tummy tuck for like a week. And she was like, I know I can put pressure on it, but I feel like I can't.
That's positional.
It was positional.
Positional.
That's what
we're so
positional.
I critically look at the way they position my patients, and I'm fortunate to work with really good nurses. But
we roll people sometimes.
Yeah,
and stuff gets
and
moved.
so I'll check their positioning on top of what the nurse does, and that's their main job. But even with that, you can still have positional issues.
And it could be something little that they don't even really see, or maybe the TED hose got bunched up behind the knee, something. So these positional ones go away. You walk, you make sure you're not super swollen. It goes away right away. Incisional is what we deal with
all the time.
This is normal.
So if you have plastic surgery, incisional numbness is going to be very common. And especially in plastic surgery, plastic surgeons raise soft tissue flaps. So they divide those nerve endings to do the surgery itself.
Remember, those come all the way to the skin.
Yeah. Imagine that the tree that arborizes out, it arborizes out towards your skin, meaning that it gets smaller towards your skin. So the nerves are big or deep, usually underneath the fascia, underneath the muscle, and then they come up perpendicularly from your fascia or your muscle into the skin. And so when you develop those flaps, you divide those small nerves. You can't see them. They're microscopic.
Yeah. You can see the big ones, though.
The big ones you can't, but the small ones you can. And the big ones are serious. Like every surgery I do, I have to watch out for this nerve or that nerve. So you have to know your anatomy. But the incisional stuff we're talking about here, not near the big nerves, the stuff that could be very consequential, you're going to divide those out. And clearly you're not going to have sensation there, or it's going to be a lot less.
Yep. And then we also put an anesthetic solution in, which causes numbness. So it's a combination as things start to wake back up. The number one thing, especially with face and neck lifts, is they're like, my face feels, and I say like wood, and they're like, yes, because it's hard from inflammation, but you touch it and it's like you're touching wood, because it's like numb, but you still have pain. Like, how is that possible? Well, that's possible. Like Dr. Martin said, like you're only disrupting those ones at the very surface. The deeper ones underneath are still like, yo, bro, what happened here?
So if we're using the tree analogy, you got the trunk and the bottom of the tree. Imagine you just cut the branches off the top. So the other part of the tree is still there, right? You're not doing a spinal cord injury where you're not having any propagation of that electrical current to and from. And they wonder why. At the base of the trunk. Yeah, that communication is suddenly cut off. Yeah. We talked about the synaptic spaces and how much communication there is back and forth between even the very teeny tiniest of tiny dendrites at the very surface of your skin back to your brain. Which is so crazy. You think about it, like you close your eyes and you touch your cheek, you know exactly where you're touching it. And these nerves are so small, I don't even see them when I go in with my super, duper Marvel vision glasses on, like even when you have loops on. So it's like, it's that consequential. And I'm touching an area that probably has, I don't know, thousands of nerve endings near it. So like several miles right there. Right. And then automatically your brain knows exactly where it is. If I push harder, then I feel it. I know I'm pushing harder. I can feel that. And then I can actually feel what I'm pushing against. And that's propagating back to my brain. Yeah. I can feel my malar prominence, my zygoma. It's just nuts. It is. It's so crazy. And now you know why it's like the hardest thing to understand the human body. This amazing thing that was created through evolution or God or whatever happened got to this point where you have 60,000 miles of nerves and you literally can put your finger on one area and you can feel all the stuff around it. And and you know the difference between me touching it and you touching it. Which, by the way, I know this is very meta, but I have to say this. I've been thinking this the whole time. That's why AI is not going to take over right now. Right? That is consequential, right? You can do 1,000 million computations with a supercomputer or whatever those computers are that use atoms, like those, whatever they're called, these computers that are developing. The reality of it is so complex and there's so many things going on at once. You would have to have such a powerful operating system and computer. Like we're not there to do all of that. And it's happening all in the human body. Right. So clearly you can do computations faster with AI than your brain because this is finite. But imagine the complexity of the human body itself. And all while still breathing and digesting food and this is getting way too out getting there. Vision into our eyes. So
isn't it different? Like what part of your body you're like? Because like on some parts you touch, you know exactly where you touch, but like sometimes on your back. Isn't it like a bigger difference of because like you'll have an inch and you think you're scratching where the itch is, but it's an inch to the one?
No, it is. So I remember in neurology, and again, this has been a long time, right? But Amy probably even knows this better than me. There's part of this, the exams where they can test with needle points exactly what your excursion is between the 2 points. And if it's within a couple millimeters on your fingertip, then you're good. But if it's really far apart, you're having some dysfunction of the nerves there, where it's like very, very small in spacing on the fingertip versus the back, which is bigger, and that's normal. And the reason is, through evolution, that has happened. Right?
And there's just more.
Yeah, and on the face, on the fingers, on the feet, the areas that actually give you benefit.
Yeah, where we need it.
Yes.
The other,
Right.
Yeah. So this is inevitable, right? We're doing soft tissue damage. And, these are the things that can regrow on their own without any intervention. So what is the solution? How can you make these areas feel normal again? Well, number one cure for this is time. It's recovery. These nerves will heal and regain function as you heal and recover because your body knows right away. And this is why when I tell people, your body does not know the difference between injury and surgery. It does not. Mm-hmm. It knows we lost communication. We have massive bleeding. Like we are swollen. Like
DEFCON 4.
Yeah.
DEFCON 4.
Like it is an urgent situation.
Yes.
Even though you're like, but I chose this. But like, yeah, your body doesn't know that. So you need to heal and you need to be patient because as we talked about in the same episode that none of us can remember, we asked Nils how fast a nerve grows.
Oh, Nils, microphone.
Do you remember?
Do you remember?
Do you remember the episode?
Nils.
We're going to remember.
Yes, it was like millimeters per day.
Yes, very good. 1 millimeter.
Mm-hmm. Which still seems remarkably fast.
Tiny little bit, but it's still
crazy fast.
Yeah, it's insanely fast. So your body's working really hard. It's like, the electrical line's been shut down, like Comcast and Excel Energy, everybody's there. Everybody's trying to make this be better. So giving your body time to do what it needs to do to heal is the number one thing. There are a few things, though, that you can do to speed this up. Number one is minimize swelling.
So important.
Yeah, because again, pressure, like the neuropraxia, pressure and just distension of nerves can further irritate them.
Edema, swelling in the soft tissue can affect the way that nerves function.
Because putting pressure on them, and it can blunt the signal.
Everyone's been stung by a bee probably one time in their life. It gets numb in the area where they sting, but it still burns, right? So that's because all that edematous fluid. Mm-hmm. So swelling, inflammation, all these things are terrible for healing. They increase pain. And then they slow the process of nerve regeneration. Yeah.
So the things you can do to help with that are staying hydrated, limiting your extra salt intake, maybe stick with something like element electrolytes, elevate the area, and ice. You get your rice. Rest, elevate, and ice.
And then down the line, cryotherapy.
Oh, that's our next slide. Okay. Those are our advanced. Yeah. This is just our acute. It can take several months or even up to a year for full sensation to return, and that's normal. Like how fast that happens in a person, that is normal. Yeah, I love it when somebody comes in, they're like, well, I'm still numb and it's been like 3 weeks since surgery. Like, do you think something's wrong? I'm like, well, no, your muscles are all firing. Like you have normal sensation. Like you're fine. Dr. Brent, let's talk a little bit about the rare case that a cosmetic surgery would actually permanently damage a nerve.
Yeah, and that can happen. And
what are the tops?
That's devastating, to be honest with you. Yeah. That's the one thing as a cosmetic surgeon. Because it's elective, right? You don't need the surgery. So the last thing you would want is permanent nerve damage. The things that come to mind are obviously facelifts, especially the facial nerves. Mm-hmm. There's a real push now, especially in the ENT side, to advertise deep plane facelifts, that somehow that's the magical answer to facial aging. And
watch our episode about plastics or facelift myths.
Yeah, there you go.
Yeah.
And we're not against deep plane facelifts, and it definitely has their place. And I like the thought of and doing deep plane facelifts. With that said, nerve injuries on facelifts are devastating, and a lot of times you really can't solve that problem, so that's permanent. So you would have this appearance of having a stroke. That would be the one area. The other area that comes to mind is brachioplasties. Great episode 2.
And a lot of that could, you're so close.
Right.
To a big
so there's nerves that run down through there. So there really should be no reason actually that you should hit that nerve, but it definitely can happen, especially more near the elbow. Then the smaller things that are more nuanced, but definitely have consequential effects. We talked about in our breast reduction episode, nerve injuries or loss of sensation to the nipple and areola, which definitely can happen with breast reduction.
And just the skin itself, the breast skin.
Yeah. And then even getting into things that are more unlikely, but can happen with tummy tucks. You can have loss of sensation going down to your inner thigh because the nerve runs down around there. I mean, you just keep on going. Any place we do liposuction, you can hit nerves. Those are usually neuropraxia. They'll come back. But
yeah, it's just it's like being hit repeatedly.
Permanent nerve injuries are really probably some of the most devastating results you could have with cosmetic surgery.
And also some of the most unlikely.
Yeah, very rare.
Hands.
Incompetent hands, very, very rare.
So people sometimes you worry like, oh my gosh, is this permanent? Because it's been like 5 weeks. Like, no, like nerves grow real slow. They could get, you're damaging a lot. Think of it like completely like taking out the grass. All those tiny little blades of grass can take a long time to fill back in completely to have a nice full yard. So just know that time is really the ultimate cure, but keeping your swelling down and following your doctor's instructions for mobilizing, like those things will really help. Okay. But Amy,
I'm still numb.
I'm still numb.
What's going on here?
What else can I do? And this, again,
the tapping.
Yes.
This is Amy's favorite thing to say.
Tapping.
I feel like no matter what's going on in the world,
tap it.
All of our political issues, everything. Yes. Amy's answer is just tap it.
Feel better?
Yes, I do. Actually, it kind of calms me down.
It's kind of nice.
Thank you. I feel good.
Is it okay if someone comes in and injects your eyelid now?
Yeah, that's good. Thank you.
Yes. So tapping is great because it's gentle. I always tell people it's raindrops, not hail. You're not like abusing your soft tissues. But what tapping does is it just kind of helps wake everything back up. It brings blood flow to the area. I had back in the day, a sports massage therapist who thought that tapping was like the key ingredient essentially to any eye cream. He's like, well, it has nothing to do with the ingredients. It's literally just because they tell you to tap it in, and that tapping is what stimulates collagen, and that's what's actually doing the work. So you could literally just tap and not use any eye cream and get the same result. Is he right? Maybe. To potent, tapping has some great things about it, but really it's really helping to stimulate those areas. Dry brushing is another one that I didn't put on there, but it's on that same line of tapping, just stuff to really stimulate the very surface of the skin. Gentle massage, I say gentle because people tend to think of massage as something that's really deep. Well, when you're pushing, even gently pushing on some of these areas, you're pushing through it. If you're getting to the muscle, you're kind of pushing through those areas you're wanting to stimulate. So gentle circular massage, gentle tapping, dry brushing, lymphatic massage, those are all great things to do.
Acupuncture.
Yeah.
So when I first met Amy, she always talked about Eastern medicine. I'm like, this woman won't shut up about Eastern medicine. And then after 10 years, I'm absolutely convinced that Eastern medicine is the answer for most things. And acupuncture could be so helpful in the postoperative recovery phase. It reduces edema. It'll stimulate nerve growth, and it'll reduce pain. And that's Western science confirmed.
Yeah. I mean, you can... a very skilled acupuncturist, I mean, obviously they're sticking needles through soft tissue and you're sticking them in areas where there might be big nerves. Like they understand the nervous system very intimately. So they can do really cool things to help, again, stimulate that kind of nervous system firing further up the chain to really help bring nutrients down to the areas that need it, and reducing swelling, calming your mind, like all things that really help in recovery overall.
Yep.
I didn't put cryotherapy on here.
It doesn't matter.
It's more about inflammation with cryotherapy versus
inflammation, edema. It's all the same stuff. Yeah.
Yeah.
Okay. Physical therapy, structural massage, cryotherapy. I mean, at some point you could even get into IR therapies. I mean, all these different things that work.
Hyperbaric is one I didn't put on here either.
HBO
could really. I don't know that there's actual research on nerve regeneration with it, but certainly for tissue recovery.
100%. I mean, I've read these studies. I'm not saying we're experts in that, but definitely not regeneration, but injury. Spinal cord injuries, putting them in HBO has benefit. It depends on the type of medical problem they have. There are some things you don't want to do HBO for. One of them I was reading was like certain types of breast cancers and things like that. But in reality, hyperbaric
oxygen and everything
definitely has a benefit for recovery for sure. I mean,
oxygen is life. Yeah. I put structural massage on here, and not everyone may know what that is. And in addition to talking a lot about Eastern medicine, Dr. Martin said we talk a lot about Rolfing or structural massage.
Here we go.
You
should Rolf and swim at the same time,
right? If you have had say you have numbness from a positional and or neuropraxia, like from an injury or from a positional thing, or let's say you had a surgery that has caused you for an extended period of time to force yourself into a position. Like you had a breast surgery and you've been walking like this, and now you have numbness that is radiating down your arm, and you got impingement. You have some thoracic outlet, which is actually impingement of the nerve under the rib, like against the clavicle and the rib. Structural massage is a much deeper type of massage that helps realign your body. So it could be, and I've actually recommended this to a couple of patients after surgery who have a severe asymmetry. Like they have a pelvis that's very rotated, or they have one shoulder that literally is almost like this. Like it's that bad.
I remember when I was heavier and less in shape and I was having back problems, you sent me to the lady who did structural massage, and she was half my size, and she got on the table with all of her body weight and was doing things. Yeah. It was crazy. And at one point I'm like, I was worried about her falling off the table. Like, but it was very much a different type of massage experience than what you're talking about. And, you know, her focus was athletes, basically. She would do like NFL athletes. That's what she did for a living.
But most structural therapists do end up working with sports teams or athletes because they're the people who get, you know, maybe repeated injuries.
And it worked.
It works also for things.
It absolutely works. She only worked on my hips and my quads, basically.
Fix that low back.
Hamstrings. That's all she did.
Yeah.
And my butt.
I mean, really powerful things specifically to help with nerve impingement, nerve pain. I mean, really, really powerful when you've gotten kind of past that point.
Sure.
So number one thing you can do, be patient. And I didn't put that on here either, but I'm saying it to you.
Be
like,
patient.
Be patient. These things take time. And in some areas, there may be, even when you have sensation back, that like things still might just feel a little weird forever after surgery. And it's not that it's numb, but it just might feel a little different, right, than it did before.
Yep.
And that doesn't mean you have permanent nerve damage or that anything is really wrong. But this is my key takeaway from all of this. And I really do believe this. Numbness is common, but in very rare cases, surgery can result in a permanent loss of sensation. We talked about some of the injuries that can cause that. There might just be a difference in sensation, but it's not necessarily numb forever. Like you'll feel it again, but it might feel weird. Your surgeon will discuss these risks in more detail, but never hesitate to bring your concerns up pre and post op with your surgeon. You know, one of the examples Nils brought up was people who have numbness that travels back on their scalp after a facelift. We talk about this so much in our brow lift episode. Yeah. It can really be disconcerting.
I don't know. No, sorry.
Or people wanting to like brush I tell people to be so careful brushing your hair for, you know, the first like 6 months after a brow lift or a facelift, because like even your hair can feel numb. Like how can your hair feel numb? Same reason. You know what makes your hair stand on end? Nerves. And little muscles that get stimulated by the nerve to pop up. Your hair, it has nerve endings, right? That's why it hurts when you pull a hair out. That's the nerve. So these are normal things. So don't think that you're being crazy. You can tell your doctor, like, my hair is numb. You know, like they'll talk you through it. They'll come back.
And I do think that nerve injuries, or at least on the plastic surgery side, are rare. It would be more of a concern with orthopedic surgeries and then obviously with spinal surgeries. Yeah. But it's a rare in plastic surgery. But I'm just being very honest. Most of the surgeries I do, that's one of my primary focuses.
It's on every consent we have people sign.
But it's to stay away from those nerves that are a problem.
Yep.
And like I could name all of those in my head right now. I mean, that's how part of it every day for me for working in the OR. That's how important it is.
Yeah.
But the numbness we're really referring to now is really incisional numbness, stretching numbness, swelling numbness, and those will, in all cases, go away. The one last thing I wanted to add, and we're really talking to people that are interested in cosmetic surgery or plastic surgery, but if you have diabetes or you have health problems, you may already, you're a smoker, you may already have nerve problems. Yeah. And if you do surgery and you get numbness from the surgery, your nerves may not come back.
Especially if you are a smoker or diabetic or have just uncontrolled blood sugars in general.
For example, if you do an orthopedic surgery in your lower extremity and you have edema and swelling, you have incompetence of your venous system, and you have diabetes, you have chronic edema down there and also an inability to heal because of your diabetes and like problems with your nerves from your diabetes. Mm-hmm. If you do surgery down there, you should expect that you might have permanent numbness in the areas that they operated on because you might not be able to regrow those really superficial nerves back. So it's just like a tree. It's the same thing. If you don't have an environment for those tree branches to grow, they're not going to grow back. Mm-hmm. And that's why health is so important. Health is so important for surgical outcomes. And that's why we're so rigorous when we pick people for plastic surgery and elective procedure, is to avoid all these health problems they have. It's not a judgment on them. We just don't want to make them worse.
Yeah, this is an elective surgery. We want you to heal. Yeah.
So if you do have diabetes or you do have all these problems, then really work on those and get those under control so you can do these elective procedures.
Yes.
For this reason.
Yeah. But you're normal. Numbness is normal. Varying degrees of numbness, totally normal. But definitely talk to your surgeon about it because they can also help you kind of alleviate your fears a little bit. Thank you so much, everyone, for taking this journey on the Magic School Bus with me.
I like this.
60,000 miles, a nervous system. Feel like I should have a jingle. All right. Everybody's like, oh my gosh, turn it off. This is where I'm going to start getting your annoying comments again.
We're going to get those no matter what. Yeah.
Fair enough. I am.
I welcome. Please. Yes.
Yeah. So.
Yeah, I know. We know Nils is the good looking one. Yes. We got that.
With that said.
I won't shut up. I got that. There was like 3 of those. Can that guy just shut up and let the woman talk?
Yeah. Followed by she's annoying.
And then she's annoying. I don't like her hair.
Right? So
It is kind of fun. It's not consequential in your life. It's kind of enjoyable to read those.
We really appreciate everyone who listens so much. And I know that this was probably more sciencey than most of you would like, but there'll be some good clips on TikTok where we just talk about the fun stuff, like why you're actually numb and not about synaptic processes and negative feedback loops. So
I feel like TikTok would like axon discussions too and propagation of action potentials.
Probably. Yeah.
Right?
So definitely share this with a friend if you have a friend who's having surgery
Are you
or
saying no in that, Nils?
You're numb because of a conspiracy.
that'll get the likes. We're not sure why you're numb, but we're pretty sure we know who caused
globalists.
it. Yeah. So leave us a like, a comment, a rating, review. It really does help us. Here are all our social media handles. We're at Beauty and the Surgeon Podcast. We're also at Jason Martin, MD, even on TikTok. So find us on TikTok. You can leave us a voicemail at 303-630-9038. If you have questions or concerns, leave us a comment. We love your comments. We really do. And also, they're great for helping other people. I mean, we have had some amazing people share their own personal experience with plastic surgery in our comment section, and it is remarkable. So far better place to come than Real Self. I'm just gonna say that. So we're giving you the real deets here.
Yeah, I mean, Real Self has its place, but we're here to try to educate you, empower you, and make your surgery experience
not
better.
freak you out.
Yes,
So.
exactly.
All right. Thank you everyone so much for listening, and we will see you here next time.
See you later.